In this video, we will discuss about one of the approach to treat the chronic inflammation. Um, so before going into the treatment approach, we need to first understand how this inflammation works. So we will understand this thing with the help of or with the help of how the treatment process works at the site of injury. So whenever a body observes injury, what will happen is that neutrophil will come near the site of injury as a first responder. So and this transfer of neutrophil occurs in the blood vessels. It will it will unstick from the blood vessels and then move towards the site of injury. So uh, previously in the past it was not clear how this unsticking of neutrophil occurs, and this because of this they would not be able to understand the mechanism by which the neutrophil moves from neutrophils unbinds from the blood vessels and move to the site of injury. So how this is related to chronic inflammation? It is that if the neutrophils is attached to the site of injury for a longer duration of time, it might cause uh, prolonged inflammation that might lead to chokeage or even blood stroke. That might lead to blood stroke or even more severe problems. So recently, people have identified how this unsticking of the neutrophil occurs from the blood vessels. So the zoom in part of this has been shown here is that in a way that the neutrophil trailing edge, that is mentioned it here, that is and the lowest layer is the endothelial cells. So it is attached to the ICAM one through disulfide bond. So the PDI family, proteins from the PDI, that is protein disulfide isomerase, helps in detachment of this neutrophil from the ICAM, and this detached neutrophil can then be moved towards crawling process as it is shown here. That is in this process the addition of neutrophils is done to the white blood cells, and then these white blood cells will take the neutrophil to the site of injury. So the idea that is developed from this fundamental finding is that if somehow uh, this PDI can be inhibited, then it will prevent the movement of neutrophil to the within to certain part of the body, and by preventing this movement of neutrophil to the certain part of the body, they can reduce the chronic inflammation at certain part of the body, thereby preventing, we can say, preventing the autoimmune response or exaggerated response at certain part of the body, and that could finally uh, helps in reducing the chronic inflammation effect, or we can say uh, is a step towards treating the chronic inflammation at a specific site. And this thing has been and this thing is related towards understanding the how these white blood cells function, when we can say how these white blood cells functions towards immune response. So because this detachment of neutrophils with the help of PDI happens whenever a body observe a injury, and it generates a immune response, and in uh, and in res- and against this immune response, the PDI family will to starts to start to remove the bond between neutrophil and ICAM1 uh, as it is shown in the figure. So this is one of the approach by which chronic inflammation can be targeted. So I hope you have understood some part of this chronic inflammation treatment approach. If you need to understand more things in detail about chronic inflammation and this new finding, that is neutrophil unsticking to from the blood vessels, then you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.